Good morning, good evening, good afternoon, Dr. Pablo. Hello, hello, hello. Hold on, I got another video going somewhere. Give me 1 minute. And how is everyone today? All good? Today's video is going to be very short, but very, very interesting. I'm going to cover what you need if you just got diagnosed with cancer, what you need to do, what you need to think about, and why. I just need to check a couple of things while a couple of other people log in, and then we will get started. I'm looking for something just to check that something is running. It won't be 1 minute. Very good. Very, very good. Very good. Well, welcome everybody. Where are you all? Can close that one. Welcome everybody. Sorry for the short delay. Okay, so today is what you do when you get started. You've just been found out you've got cancer. You're in a little bit of shock. Karina won't be joining us today, but she will be on next Tuesday and Thursday. Thank you for the nice comments on the people in Spanish that like to have somebody speak in Spanish. That's good, and she really enjoys it. But we have a lot to do, two of us, and two places at once is difficult. I'll just play a little starting video to kick us off, and I'll be back right after the video. So I'll do the English one. I'll be right back. Don't go away.
GCMAF is used for the activation of your own microphage. It is made from colostrum, mother's milk. GC is the protein name and the MAF stands for macrophage activating factor. Macrophages are found in your blood and float around and absorb all bad and faulty cells they find. They also clean up damaged and unhealthy tissue. You see evidence of them when you have a cold out of your nose or bruise yourself. The yellowing is the microphage cleaning up in that area. So our bodies are amazing, aren't they? Many things affect the production of these naturally occurring friends in the blood. Surgery, cancer, accidents, falling, parasite and viruses, vaccines, all illnesses to name a few can tax your body and cause levels to become very low. We have 14-day holiday programs to boost your body's immune system. To learn more on how to improve the frontline defense of your immune system, visit Atlantis Health Retreat, special offers.
Very good. Very good. There's nothing worse than finding out you have cancer and being diagnosed. It's a shock to you, to your family, to everyone. You don't know who to talk to, and that's a problem. That's a big problem. It's slow getting started today. Sorry, I'm trying to find a file. Maybe it's not here. There it is. So I'll just upload that. Good thing is I got the the thing running live successfully today. Okay, that's uploading. Okay, so you've just been diagnosed and it's a shock. You don't know who to talk to, you don't know what to tell your family. The best advice I can give you, 20 years of working with people, and you know, men and women alike, a percentage of them like to keep a secret from the family, and you know if that has to happen, because every family has got its own dynamics, yes? And it's a problem, and nobody can tell you what is correct or not. All I can tell you is you need somebody, you need a support group, and that will help you a lot. The most important thing, I'm having a problem uploading the file. The most important thing is no delay. The more you delay things, the more problems you're going to have. And that's a big issue. So I'm going to have to share my screen with you because that file's not uploading, which is no problem. It just has to be done a different way. I have to close everything down. So open this up. You can't see what I'm doing at the moment. Wow, that's big on two screens. I didn't want on two screens. Okay, I'm just going to read the slides in. Oh, good. We'll get through it. I'm having a network error, so there's nothing I can do about that. So it's a problem if it's a long weekend and a lot of people in the area is on the internet. Okay. So we're given a couple of minutes delay and let's get started. So choosing to get started. So you've just discovered that there's an issue, and the issue is of big concern. It potentially is cancer. They want to do some more tests to confirm it. Okay, so what are the processes? The next stage, so you went with a symptom and they said it's a suspected tumor, maybe. They need to do some more investigation. This is the part that happens, a biopsy. The biopsy gives them permission to have the scans and the expensive blood test. Well, they're not expensive, but in the US, they're ridiculous, the prices. They're you know, $300 to $500 for a test that is in other countries $100. It's ridiculous, the prices in the US. Because it's paid by the insurance company, they need to authorize it. They won't authorize it without a biopsy. So that's a complication. So you want to avoid a biopsy until you're ready. There may be a time when you do it. That is a choice. But wait, the homework needs to be done. If it is cancer, you then have to say, which path am I going to go? Do I want to do chemotherapy? It's a possibility. Radiation, surgery. These are the three options, often referred to as heartburn and poison. Then there's the alternative therapy. Do something at home. A lot of people play games with that. They listen to people on Facebook and you know, chat groups, and they say, oh, my friend ate apricot kernels and they became cancer free. It can happen. I've seen it, but it's 100 to 1. You don't want to just put all your eggs in one basket. Number two, which the last 3 videos I've done in the last 2 weeks explain that most people don't do the formula correctly. What is the problem with that? If you're going to do something, you need to get it right. You need to get it right. You don't want to get it wrong. You end up dying of ignorance, dying of stupidity, dying of faith in somebody who really isn't an expert in that product. And that's like baking a cake, you know, and there's an ingredient missing. You don't put in the eggs, or the slightest thing, oil, you don't put in the slightest thing, and the whole thing is a flop. And when you're talking about your life, you cannot afford to do that. You really got to get it right. So When they start to do a biopsy on the day they find the problem, the lump in the breast or anyway, say, no, I want to wait 7 days to think about things. Choose your path. Once you choose your path, then there are things you need to do. You need to get blood tests. Email us. I'll send you a full list of blood tests. Search online cancer markers for whatever the suspicion is. You need to check for bone issues. So if it may be advanced, and listen, more than 50% of tumors are advanced. Yes, if you discovered it or you've been ignoring it for a while, it may have spread somewhere else. So you're going to need a CT scan. You're going to need a bone scan. Now, usually what they do is they'll do, okay, you've got breast problem or esophageal problem or stomach problem, digestion problems, pancreatic cancer, liver cancer. They'll do a scan of the area where the problem is. This is a problem because you're going to have radioactive chemical put into you. And you have to do this when you're ready, not the day. You're still thinking about things. You have to have that done. So you have to find a sympathetic oncologist that will agree to let you do a scan of the whole torso or the head. And sometimes you have to say, I've been having headaches too, and I have pain in the bottom of my liver, and so on. So you have one lot of poison injected, the radioactive chemical. We have some supplements to protect you and your thyroid from that. Take them, have the scan done. But again, biopsy might be needed. The next thing is the blood test and the scan together will give you a picture of this is what you have. And the cancer marker will go up as the cancer is growing or go down. Not in all cases, but in most cases. So you want to get these as close to the decision of when you're going to start. So if you're going to do chemotherapy, you say to your doctor, okay, if I choose chemotherapy, a couple of things I want to agree to. I need to have a port fitted. What is a port? Email us. I'll send you a picture of it. The port protects your veins. It's an access point under the skin. They put it on the opposite side of wherever the cancer is. And it's an access point to give you IV. Why do you need that? The IV of chemotherapy damages your veins. It's very, very toxic chemical. It causes your hair to fall out, your teeth to become loose. It causes complications. Anywhere where you've got a potential infection, like in the gums, yeah, so it can cause them to become infected because your immune system's not keeping that under control yet. So there's another thing. Don't choose to get all your teeth done. Everyone will tell you the teeth are a big cause of tumors potentially. Don't get them all done now. Get them done before you start any treatment, not after, because they are a distraction from your whole body fighting the tumor. You can't do any teeth work afterwards. Go and get it done now. Pay the extra. Say, you need to get me in now because I'm going to have some treatment. I want all my infections out of my mouth. That's fine. And boost your nutrition while you're having it. Lots of vitamin C. And if you find a holistic dentist, they will remove all of your amalgams, and they will give you IV vitamin C, probably 60 grams over 2 hours with multi-mineral in there. And if they know about GSMAF, they can add that in there and boost your immune system and clean out any toxins that you get in the process of having your mouth done. I'll just talk briefly about, we've done a thermography weekend, one weekend. And the thermography shows any heat anywhere on your body. And so people came in and we were just doing a free scan of the top area of, from breast to the face. And people were excited to see an image of themselves. But what it showed is a hot spot in the mouth, and in the women, it was hot weather. They had the open brows, like the singlet, and you could see all the way down here to the breast, a hot spot. It was mind-blowing to see that. That was like, wow, really awakening for me. And there were 3 holistic dentists that came and wanted to order the machine or send all of their clients to us to have the screening done in the future. It made us very, very busy. Why did they want to do that? They wanted to know which one is the more important to do first. And maybe the lady doesn't even feel pain in that. Maybe it's an old root canal that they didn't even realize was a problem because there was no pain. And so that's important, that your mouth is fine. So Now you've evaluated the options. You know you have to do potentially a biopsy. I hate them because I believe they make the cancer metastasize. You do not have to do a biopsy here. We don't need it. If we have evidence of the scan, we have evidence in the blood test, we don't need any more evidence. We know what it is and we know what to do with it. We just need to know where it is. So the scan, PET scan or CT scan, and that depends on the location, the tissue, and a bone scan are important. We are the best facility in the world for bone cancer. It's not always going to happen. You can't give anyone a guarantee of anything. But every single bone cancer patient that has come to us, maybe they had more than just bone cancer, but all the bone cancer in all the patients we've won. We have not failed in bone cancer. It's amazing. In fact, sometimes I think I should only take on clients with bone cancer because it's more enjoyable to have a 100% success at the moment. God willing, it keeps going. Sometimes there are other cancers, there was complications and they didn't make it for those reasons, but that they came here for bone cancer and we tackled that. That's another issue. And that's why I say do a full scan. So if you choose alternative therapies, the things that we combine, the best therapies in the world, or chemotherapy, once you've made that choice, the rest of this video will be related to coming to us, coming to a place that does alternative therapies. So how do you choose a place? You need somebody who's not doing one thing. We have people coming here after going to Mexico and they've lost so much weight. They're doing coffee enemas, they're doing juicing, they're doing 0.2 mil of GCMEF. It's not enough to put out the fire in your body, and vitamin B17. They're paying 25 to 35,000 a month for that. It's a waste of money. It's like going to your local doctor and having 30 grams of vitamin C and say, I'm doing vitamin C therapy. It's not enough to cure cancer or make a difference. It's not enough. You need 60 to 120 grams of vitamin C. You need very high levels, and you can't put that in a vein. You need a port fitted. So once we talk, you fill out the form online. We have a consultation, 2 or 3 consultations, get to know each other. We're confident. We go over the pricing, which depends on your case. The more advanced you are, the higher our price. Why? Because in the more advanced cases, we include the option of 24-hour nurses. We do extra scanning, extra things to monitor you. But the good news is you don't need a biopsy to have a scan here. When you arrive here, we will do, in the first couple of days, we will fit a port. If you don't already have it, if you didn't get it before you came. That's a few hour procedure, and usually they keep you in the hospital for a few more hours before they release you. And so that's done the day you arrive. If you arrive early morning, or if you arrive lunchtime, we do it the next day. It's usually done in the afternoon. You go in, you have a very minor little bit to eat in the morning, and then you're fasting until you go into the hospital at 1 o'clock, 2 o'clock, and then you're out 3, 4, 5, 6, depending on your timing, because it's not the main surgery. So if they have somebody else having a big surgery, they don't know if it finished in 2 hours or 3 hours. So and once that's finished, you come out and we head to the spa. If it's late at night, we stay again in the accommodation in a nice apartment, and then we go to the beach, the health retreat, and you arrive there. So you'll arrive at nighttime. We'll have dinner on the way home because you'll be hungry because you had the port fitted. You haven't eaten all afternoon, so we'll stop at a very nice place, have a meal, and that'll break that's 20 minutes of getting out of the city. We stop at a very nice place, toilet break, have a nice drink, and then it's an hour and a half drive, beautiful roads, all new roads to the coast, and we're in Jipipi, beautiful location, a wealthy person's location, the safest place in Ecuador. And the next day we will greet and meet you. You have what we call an induction. You'll meet all of the staff. We go over the rules. We nominate one nurse to be your friend, extra friend. So if you want to go shopping or you want to go out, you call them or you organize it during the day, they will take you. Most people use that service for a week. You can use it the whole time you're here. We also have some local expats, US people retired here that like to take you out to restaurants and so on. So in the week off, you will have somebody, if you want to go out and do some things, you can do that, no problem. And there's beautiful, healthy places, beautiful salads. The meals are good. The biggest complaint we have is nobody asks the right questions. Yes, what do people complain about? Not a lot now, but we had 3 chefs in our previous location, and we couldn't satisfy the palate of people. Everybody's an individual, so I'm not cooking for you, and I'm not paying somebody to cook for you a meal that they don't like. So we took out the meals. You organize your own meal. So you need to come with somebody, or we have local people who will cook for you, but you have to organize that. We stay out of that because I'm a food critic too. I like things a certain way. So I understand that. So then on the Saturday, so usually you arrive Wednesday is the best day. Every 3 weeks we have intake. Then on the Saturday, you meet 2 doctors, or 1 doctor and the other doctor the weekend after. And they will do a full examination on you. What they're looking for is things you do not know is wrong with you, things that you didn't know. So by then, they have a copy of all the blood tests we've done, which nobody will do in the US. We do so many to see if there's anything you don't know is wrong. Once the blood tests are done, we will have them ready for the doctor, and you will have a complete examination with 2 doctors. The 3 of us have a meeting with the head nurses, and I design your plan. And that's it. 2 weeks. So what happens then? You will start 1 week of IV therapies to fix the problems you didn't know you had. You're anemic, you have a little bit of edema, you have pain, whatever. We will get all that under control. Then you'll have a week rest. The week rest, you still do the GCMEF and other things. You just don't have IV. Losing my voice. So 2 things can happen. You arrive, and then you have 1 week of therapies, week off 2 weeks, week off 2 weeks, week off 2 weeks, week off 1 week. Or if you started the home program at home, you arrive and you do 2 weeks, week off 2 weeks, week off 2 weeks, week off 2 weeks. It's the same number of weeks, but it depends on if you've done our home program for 6 months before you came here, you don't need that 1 week. We already know you. We've been working with you online and talking to you often. So we know your case. We know all about you, and there's no need to do that week getting rid of problems, because usually we've done that. If we haven't, then it'll be the 1 week, week off 2 weeks. People are tired after the flight here. So the 1 week of IV and then the week rest is really appreciated. So we're happy to do that with all cases if you're tired. By the end of the week, all that nutrition pumped into your veins, you usually will feel stronger and better and less pain and more energy. That can be a problem. If you suddenly decide to do too much, it's a problem. So we talk about that in the induction, getting you into routine, introducing you to the clients, the other clients, introducing you to the staff, and laying down some fundamental rules that will keep you strong, healthy, and safe. Okay. So on that weekend, before you start on the Monday, the IV therapies, we get a CT scan or whatever scans needed, X-rays, bone density scans, whatever's needed. That can all be done on the weekend before you start, and we will repeat them at the end of. It depends on the case and which program you're in. Every 2 weeks we repeat. Every week we do blood tests. Normally every Monday. So the first Monday you're starting, or the weekend you arrive, the Friday, we might have got them done before you had the port fitted. Then at the end of that 2 week cycle, we will do it again. And then it depends on you at the start of the next week. So if we done on the beginning of your week off a blood test, and we found that something was out in your blood, we would give you something to balance that. Then we need to check that it's balanced before we start the next lot of IV. Easy. So we keep an eye on you very closely. You don't pay for any of this. This is included in your program. As many blood tests as I order and CT scans is all included. You don't have to worry about that. And it's the blood test is often done in our spa, in our facility. And the scan, we don't have the scan machine. It's 7 minutes, 8 minutes down the road. So you just go down the road with my nurse, and they get you in. Usually, 9 times out of 10, the maximum waiting time is 15 minutes. If you have to have contrast beforehand, our nurses pick it up in the morning, give it to you at 4 o'clock in the morning or 5 o'clock. And then when you go at 8 or 9 o'clock, it's done. You don't have to wait down there for that time to happen after you drink the liquid. And that's it. Most tumors, once we know where they are, you do not need to have contrast. Maybe the first one and the last one. But if we decide to do some in the middle, it's to see the size change. They know where it is. They just need to measure has it changed or not. So you don't need the poison in it. The radioactive material is in case it's hard to find. But once they know where it is, 90% of the time it's clear, especially in the brain, esophagus, lungs. You can see it just with an X-ray or with a normal CT scan. It's not a problem. And that's it. We're into it now. You're doing IV therapies for 3 to 4 hours every day, maybe 5 hours. So you're starting at 8 o'clock in the morning and you're doing IVs to 12. Then you go home for 2 hours. At 2 o'clock, you're back in the spa and you're doing other things. Sometimes you finish 11 o'clock and you go home, come back at 1 o'clock. And then you're doing hyperbaric oxygen. Accelerates healing. Energy spa. I've got a list here. This was a little presentation I was going to put up, but it didn't want to work for me today. And I was running late getting home today. We had a lot of extra people coming into the spa today. Live blood viewing, ECG, blood tests we do every Monday. And it depends on where the tumor is. We inject the GCMAF around the area of the tumor, magnetic pulse, and the hyperbaric oxygen. And also, in addition to vitamin B17, GCMAF, ozone therapy, we will also, so the B17 GCMAF can be put together. The ozone is injected close to the tumors, and that's not good for all clients. It depends on the person and the cancer, what's going on. We have 101 therapies, which I discussed in all my other videos. In the last 3 videos, I went over them. So we do one for strengthening your bones to protect you. If you have prostate cancer, it's a big issue that this thing wants to go to your bones. If you have breast cancer, it's going to go to the bones close to the bra strap. It's a big problem. You need to strengthen your bones. It's a priority. So we do a lot of things that are proactive that will stop you having a problem that you didn't know you were going to have. Guaranteed. So it's really, really important. These other therapies we do on top of your treatment, they're all included. And so liver detox, strengthening the liver. We have so many people that are in shock. Yes, we start a program and their liver tumor is gone in 3 weeks. They say, wow, people do chemotherapy for so long. Bone cancer, liver cancer, very quick. Pancreas cancer, as long as it hasn't metastasized to the lining of your stomach, 10% shrinkage per day. 1% shrinkage per day. So in a period of 3 months, it's gone. Doesn't matter how big it is. God willing, that continues to happen for you. Lung cancer is hit and miss. It depends on how advanced it is when you come here, and if it's slow or fast growing. When they're very slow growing, they take longer to get rid of. Ovarian tumors. The earlier you get here, because they have a lot of potential complications. So as soon as you're diagnosed, you move quickly. Prostate cancer, the same. You can say, okay, I'm 60 years old. Most medical places now say you don't need to do nothing, because if we do chemo, you're going to have poor quality of life. If we do nothing, you're going to live. You're not going to die of this prostate cancer, because it's usually very slow. So you do a home program. But if you say, oh, they're going to take off my prostate, I don't want to do that, I want to try something else, get here as quickly as you can. I can't stress enough the sadness I have of the advanced tumors I've seen in the last year. And sadly, those people who have been vaxxed, the coming out of remission, it's caused a lot of problems. Blood clots, edema, things that they didn't have before. I got a lovely lady in Australia that was fine. And she went to a hospital to check a few things. She's sitting around a lot of vaccinated people. And they told her she was fine. She wasn't too bad. And 2 weeks later, she's terminal and dying. It's really, really, or potentially dying. I pray to God she doesn't. But this is a big problem. This is a big concern. It's called shedding. And so I tell you, to anybody if you've been vaxxed, you can't do nothing about it. But if you haven't been, stay away from the people who are for at least 30 days after the vaccination, because there's definitely something going on. Is my suspicion. They'll probably ban my video now for telling you what I have observed, but I have to tell you the truth. That's the truth. So really, really important to do that. What happens then in halfway through? We do a scan and we say, oh, this is halfway gone. At the end, if it's not gone, what do? We have a very low $7,750 a month to continue. It's 3 weeks plus your week rest before you go home, including all the products. Most people don't need that, but it's an option. If the tumor is not gone, we have a very low rate for you to stay a little longer to get rid of it. Makes sense, yes? So we give you a week, 2 weeks off at the end of the 3 months. We make that plan, and then we continue to hit it. If you want to keep going consistently, we can. Usually at the end of 3 months, it's good to have a couple of weeks just break. We already in the plan allow 1 week rest for you to fly away that week. So then the week after, or 2 weeks, and then the week after, you can start. And that's it. Let's get rid of this bloody thing. Yes, let's do everything we can with a team that's positive, full of energy. People say to me, why are you so positive? Because when you give the gift of life, when you manage to get rid of a tumor, it's like so energizing for me. It makes me feel so good, so excited, and so powerful that God was willing to work through me to heal you. And that's so important. And when we fail, the people are just glad that they tried. They tried everything they could, knowing that we put everything in to try to save their life. And nobody more than me wants to succeed, but there's nobody going to have 100% success. You can have somebody shot with a bullet. You go to the doctor, he removed the bullet, but the person will still die from the wounds. This is a problem. People ask me, the tumors. Yesterday, a doctor sent me a video of a lady, because I showed her, we get advice from one another, and I had somebody with 3 foot by 2 foot by almost a foot deep tumor, a breast tumor, and she's got somebody who's got a hole right the way through her body. It's terrible, and it's very advanced, and the delay before hitting it with everything is very sad. In the last year, I've had several men and women who had metastasized to the bone. And one of them said, I'm going to wait I've got 2 more months for my CT scan covered by insurance, so I'll wait to see how it is. He became a paraplegic in that time. You can't wait. You do not know when it's going to penetrate into the spinal cord and turn you into a paraplegic. You need to move today. And I know that's, you have to sit in my shoes to see, to hear the people that didn't wait, that waited, and it's a problem. There's also people scamming. So if you get anybody offering you products in my, you need to talk to me and see my face on we don't take money from anybody until we've spoken. We don't just speak on the phone and say send us money. So don't be scammed by anybody. YouTube's having amazing, incredible number of scammers online scamming people. I haven't heard of anybody, but I've been told to do that little warning for people. You see my face. We talk on Skype or we talk on WhatsApp, and you know you're dealing with me, and then you don't have a problem. And that's it. That's it. That's basically what I needed to get the message out to you. So I think I've covered everything on that. The beginning of this video will have a front cover that's going to have the phone number and everything on it. So feel free to ring us. The contact us form has a form to fill in. It takes a while. I don't know why people spend so long on that, but we need to know everything about you. We need to know if you have asthma, you have osteoporosis, if you have other issues. And so the form is to let us know everything about you so we can prepare. And because we're going to treat everything that's wrong with you. We're not going to focus on the cancer. We want to have a holistic approach. So when you go home, everything is good. We have people who work on psychological issues. They take you out for lunch and talk to you. It's included in your program. We have all different sorts of people, just maybe handling stress, coming to grips with arguments in the family. Everyone has somebody who doesn't want you to come to another place to do therapy. Recently, I had a beautiful lady leave, not leave early, but leave on the day of her 3 months. She still had some cancer left because the mother didn't believe that the best doctors in the world were in the US. She went home. She was home for a month, got an infection, and died in the hospital of something they gave her. I don't know if you know it. Second to weapons of war, people dying from war, is medical errors in hospitals. So just be aware of that. More deaths are caused when they give you the right drug and it kills you. And the second biggest killer is when they give you the wrong drug and it kills you. Now, having been in hospital and had double knee replacement, maybe 10 years ago, I had that problem on 2 occasions. A big argument with this lady. Anyway, in the end, when we resolved it, she apologized and she said, I'm retiring and going to a nursing home. She was 65, 70 years old, but she was making mistakes. And so normally, so I had a reaction to the radioactive CT scan, and it caused my heart to go to 150 beats a minute for 6 weeks. Lost a lot of weight, and so I was on heart medication, and I can still count to 10. Yes, there was 10 white pills yesterday, and now there's only 8, and the next day there's 7. I said, did somebody change my meds? I said, you're making a mistake. And it became a big issue in the hospital. She was offended. She was insisting I take the hospital and stop wasting her time, that she was busy. Anyway, in the end, I was correct, and she apologized, and she told me she was going to retire. She was a lovely lady. She was just busy, under pressure, maybe looking after too many patients, but these errors happen. Antibiotics given to somebody with kidney problem, you can die within 14 days on dialysis. These are a big issue that happen on a daily basis, and nobody tells you about it because doctors have a license to kill you. Sad as it is, they have a license to do that. They get away with that. You don't know about it. Nobody's going to tell you about it. So be careful. Do question me, question them. It's fine. At the end of the day, they want you to be well, and I want you to be well. And I just want you to be aware of all of those things. And that's it, I think. I covered everything in 30. I was going to do it in 30 minutes, and I probably wasted 10 minutes at the beginning, so I succeeded. I want you to have a lovely day. I want you to know that I'm available here for you if you want to chat. There's no obligation. I will go over the program with you face-to-face on Skype. It's important that you get the form to me. So then I'm talking about your case. Otherwise, I'm talking about, it's no good if you ring me and we're talking and you had cancer in the I'm just talking funny now, but in the knee, and you've had your legs cut off, and we're talking about that, we're wasting time on that. If you've had cancer started in the breast, but that was removed, now it's in the liver and the bone, that's a really easy case for us. But I need to know all of the details of what you had before. So if you can make sure you get me all the details before we have a consultation, it's much better for you and much better for the consultation, because I'll be talking about your case. And I will talk about others to compare and let you know that I'm very confident or not confident. I tell you the truth, but there's no guarantee that I'm right. You could be the one that makes it quicker than other people. If you're strong and determined and quick and you didn't waste time, you're going to get a better result than somebody who spent 6 months doing something else before they came here. So with that good news, I'm going to sign off. Tell you it's beautiful and sunny here. We're in the middle of the year now, so it's coming to more overcast, but still beautiful, warm, singlet weather days. That's the good thing about here. People with cancer like to come in the winter from the US. It's too cold, and the snow, and Canada especially. We have a lot of clients from Canada because they don't like that cold. And it's beautiful and sunny here, looking at the beach every day. The beautiful sea breeze, no pollution, fantastic. And we're not far away from our spa being opened, which is a 30 apartment facility, 3 stories high, beautiful. It's on a lake. It's on a lake, not a river. It's on a lake, and fresh water, and that will be even better at that location. So in my spare time, so afternoons I'm working on the project, and in the morning I'm with you in the clinic. along with one doctor we have in the clinic daily and another doctor. So God bless. Have a good day. Get on the phone, contact me, and let's see how quickly we can get this out of your life. And that's another thing I just point out quickly. People spend 3-4 years fighting it and spend more than it costs to just get rid of it in 3 months. It adds up, especially when you do things wrong and you just wasted that money. You put that money down the toilet. Time is of the essence. Yes, it's a fire in your house. You don't want to wait until it's spread right to every organ in your body. And you want to get it and put it out so you have the frame of a healthy body to live in the future. And that's what we'll help you do. So until we meet, have a great day and bye for now.